Dr. Wee, do you want to show yourself, introduce yourself? We read your bio. And what I like most about Theresa Wee is she's a pediatrician. That's always fun. And she started Walk with the Doc, and she was a moderate following, and she wrote a couple of books about wellness. And so, anyway, before anything else, if you want to show yourself, go ahead, Dr. Wee. But can we start the PowerPoint?
Okay, now go to show.
Okay, so we're going to be talking about financial incentives, which there are not a lot of here.
Okay, you
So think of this as building the program. We want everybody to help us figure out how to do this. We don't have a lot of money. We have little bits of money from here and there. So we want to make it go as far as we can. And so you guys be thinking, and you guys can put your comments on the email form. You can email me, you can email the ahex@hawaii.edu. But let us know your ideas. Okay, go ahead and advance. Okay, so this is a national program. The agenda said we would talk about it, so I'm going to talk about it. If you can qualify for National Health Service Corps, that's a great thing. You have a 2-year minimum. You get about $50,000 a year, I believe, but you have to work in a nonprofit in a health profession shortage area with a HPSA score that's pretty high. And so not all of our locations in Hawaii qualify. So if you can't qualify for National Health Service Corps, we're going to talk about the STOPACE grant in a bit, and that's what you want to apply for. So go ahead and advance. Okay, let's see, Hawaii State Loan Repayment Program. Speak of the devil. Okay, so this is a program that is administered by the National Health Service Corps branch. So they go by the same rules, $50,000 a year, 2-year minimum. If you default, you have to pay at least $31,000 back, but it turns into $7,500 per month that you don't sue it. So it's really ugly. So you don't want to default on either of these federal government loans, because then you have a black mark for life with the feds. But this is nice because you don't have to have a high HPSA score. You can have a HPSA score of 1 and you can qualify for this, as long as you work for a nonprofit in a health profession shortage area. So for example, you heard Jim Winkler this morning. He has a nonprofit company organization clinic on Kauai, which is a health profession shortage area. Any of his providers can qualify for loan repayment from the state loan repayment program. The federal legislature, the federal program gave us $800,000 this year to spend, but we have to come up with the other $800,000. The legislature gave us $500,000, so we know we have at least $1 million to spend this year on this program. So if you know of anybody who works in a health profession shortage area, which is all the neighboring islands plus Waimanalo, Waimea, North Shore, and they still have loans, and work for a nonprofit, tell them to call me, because they can get loan repayment up to $50,000 a year. 2-year minimum for full-time service, but then you go year for year after that. We just had our longest serving person was Obi on Maui. He just moved to the mainland, which really makes me mad. But he was with us for 7 years. He better come back. Better, I'm gonna go find him. You know, we paid what, $350,000 for his loan. Anyway. So this program is wide open right now. And in fact, there are 11 people that I have to contact and tell them that they are going to get loan repayment. And I'm going to do that tonight because I've been a little busy. I have to tell them they qualify, they're going to get $50,000 a year in loan repayment each for 2 years. And then on if they want to continue on. Okay, what else do we have? Because what if you're in a regular practice on Big Island and you're not a nonprofit? How do you qualify? I don't know. What can you do? What are some remedies? Okay, let's see. It's so long.
She says somewhere in that second.
Okay. So
Because
this
what I'm doing is I'm taking
is
this. So you're going
this is a
online.
test that we're
One you're
doing.
doing
And I'm doing this. So that
We want to
we don't
make it
show it this
possible
way.
for practices to support their providers So the legislature said, they gave us 500,000, and they said you have to match it. But they didn't say you have to use federal money to match it. We can use donated money, we can use the individual's money even. So if you have a rural practice and you have loans still, for every dollar you put towards the loan, if we have a contract, we can put a dollar also. So this is how, or let's say you're employed in a practice and they say, well, we don't have much money, but we'll give you 5,000 here for loan repayment. Guess what? We can match that 5,000. So let me know if you guys are interested in this, or if you have a friend who lives in a rural area and who still has loans. Okay. Questions on those? Next. Oh, yes. Here you go.
Okay. So one caveat, I am not Lisa Rance. Lisa Rance is our president of the Hawaiiʻs State Health Association.
This is the last 4 weeks coming up next. The next
Oh.
one is week.
Where's her? Is hers
So
on?
just a little bit over there. Maybe she's gonna tell us.
I just sort of researched a bunch of different things, so I apologize if I don't have all the information, but I'll try to get like just touch upon it a little bit, and you can ask me questions, you can talk to Kelley. But we're looking at other local options. You know, the large loan repayment program for the National Health Service Corps and Hawaiiʻs State loan repayment program. However, we as an association are exploring other options. One is city and county grant programs. So there's two in particular. One is the Hawaii Island Access to Medical Care Fund. So this is overseen by Hilo Medical Center Foundation. And Theresa Wee is also with Hilo Medical Center Foundation and is the president of the State Health Association. We're sort of joined at the hip, and we sort of all leverage what we want resources we have. So what this Hawaii Island Access to Medical Care Fund does, qualifications for the subsidy program are you need to be a graduate of Hawaii Island High School and commit to a 5-year service commitment. And funding can be used for loan repayment match, or can be paid directly to a physician to get them started in practice, or provide support to hiring practice to help with providing competitive salary. And applications will be available soon through Hilo Medical Center Foundation. Shippers Wharf is another one. It is a Hawaii Island County
He's trying to
grant,
figure out.
also registered to Hilo Medical Center
Oh.
Foundation. And the city and county of Hawaii provided funds to support loan repayment to physicians in the county of Hawaii in the form of Hawaiiʻs State loan repayment match in return for 2 years service commitment. So basically, it's leveraging county funds to help provide care match for Hawaiiʻs State loan repayment.
So I have feedback from our folks online, and the conversations near the main computer, I guess that's Summer's computer, can be heard. So I think the sound is coming through Summer's computer.
And that Community First had gifted to Hilo Medical Center Foundation to administer. However, they wanted a statewide reach, so they in turn gifted it over to the Hawaiiʻs State Health Association. So this legacy program was created to support and develop access to high quality healthcare close to home instead of needing to fly off island.
And I lost my place.
Start again.
Yeah. So let me just tell you a story. So, and this is how all stories start. Kelley will email you. In the subject line, it'll say, "Can you help out?" And then in the body it'll be loan repayment program. So really, what happened was myself, Lisa Rance, and Kelley got together, and we tried to figure out how to do the state matches. And for myself, I'm not embarrassed. I'm at the Department of Health, and I go through the hallways and I look for money. And there's so much unobligated funds. So I basically ask around, and they're able to provide funding. So I think it was the year before, between Lisa, myself, and Kelley, we were able to cobble together the match. that no one else wanted to contribute towards, but we felt so strongly that loan repayment is such an important workforce recruitment and retention tool that we're able to find the monies. And now that the legislature has committed to providing $500,000, so that money for 1 year, but it takes a lot of money to provide these subsidies. But we're hoping that the small businesses associations and other civic groups will be able to contribute towards these funds. And we also found out that counties have health funds. So it starts off with Hawaii County giving, then we approach Maui County and then Kauai County. So there are other options out there. It's not always state, but the counties are also willing to give some money.
And I have to add that a lot of insurance companies, well, Queens has, as well as UHA consistently does. HMSA helped us start the state loan repayment program. Aloha Care, Well Care. We've gotten a lot of donations from different organizations. So we scrape it together usually, because during COVID, the legislature didn't have any funds to give. So now they are, but next year, who knows? So since they are now, we have these scraped together funds that can go towards a practice startup. So the reason I asked Greg, I knew he didn't know that answer, but how much should we give if we only have, say, 200,000? Do we give one practice, 100, or do we give 4 practices 50, or do we give 8 practices 25? We don't know what to do. I heard there was a program from a big insurance company that pays $5,000 a month for 2 years. So that would be 120,000. We could probably do 2 of those. We could probably do.
Can you hear me?
Oh my gosh. Talk about everything. Can you hear me? Yes? Kind of. Okay. Turn me up, man. Turn me up.
Testing.
So do we do 2 providers for 120,000 over 2 years? We don't know.
Is this working?
Okay. But it's very clear right now. Okay. So you can hear me? I'll hold it very close. No.
Okay, can you hear me? There, much better.
I think I'm back to you.
I think that's next slide.
Hear me?
Next slide. Summer, can you advance the slide?
I guess not.
At the end of the day.
Okay. Good news is they can hear Greg online. Woo! Okay. Wow. Wow. Okay. Oh, maybe Theresa. Theresa, can you advance slides?
I cannot.
Oh my goodness. Okay. Do you have your PowerPoint up and can share yours? And bump us over. Yes. Yes. Okay, you're on. Thank you. Thank you. Thank you.
Okay, hi everyone. I'm so sorry about the glitch. I'm so happy to be here. Can people hear me? Yes.
Perfectly.
Okay, great. So today I wanted to really excited to share with you. I was a burnt out, depressed physician, and I really feel I was one of the lucky ones. And today I just wanted to share my story, my life story about how, as a pediatrician of 38 years, a wife, a mother, and now a grandmother, how I want to put this topic of depression and burnout on the table. And I know that Hawaii, we really need to have our practitioners in good health, because we cannot give what we ain't got. And so next slide. I've heard
You
so
might
many
have control.
Okay.
Perfect. It's on. Perfect.
Okay. So anyway, frontline burnout, we all talk about it. When I graduated from JABS in 1979, this was a topic that we really didn't talk about. all I knew is that I was a minority as a woman. In our class, we had maybe 18 women out of the 60 group, and going through pre-med and medical school and residency, it was always, you know, you don't admit your weakness. You just keep moving forward. You just do the best you can and make sure you don't fall behind. And I know that whenever you fill out your licensure, you know, do you have any mental illness? You know, sometimes you don't even know what to put on that. And of course, as we know, COVID, you know, really created the perfect storm, and this has really, I think, pushed so many people over the top, and all of us healthcare workers have felt that burnout. Next slide. I'm not sure how to forward it. Next slide. So one of the things that, you know, was instilled in us over and over is you just make the best of it. And what I would do is I would keep it all together for my patients. But when I came home to my husband, who was also my business partner and internal medicine partner, and I came home to him and the 4 young children that we were raising, I could feel myself really just building up like a steaming kettle and not knowing where to put this steam into. But again, at work, no one would know anything was wrong. Next slide. So what I wanted to do today, there's a lot of talk about this lived experience, and this is the personal knowledge that it's a firsthand experience that I want to share with you, because we really need to shatter that taboo about feeling burnt out and depressed. And there's a recent study of medical students. If more and more people talked about their personal stories, these young students would be more likely, when they became symptomatic, to share their stories. Next slide, please. So this was about when I was 40 years old. And I found myself juggling 6 days a week and then coming home to my full-time job as a wife and mother. And all of a sudden at 40 years of age, I don't know if that was a special number, but I started to lose my appetite. I became very tired, and I thought, well, maybe it's because I'm making 6 meals a day for breakfast, lunch, and dinner, and maybe I'm doing charts at night. And I just could not sleep for a year. This was a year, and my husband was an internal medicine doctor. And I would ask him, what is wrong with me? And do you know, for a year, we just brushed it off. And this is 2 physicians living together. And one day I read about the 5 major criteria for depression, and I diagnosed myself as having depression. I immediately sought help, and with some therapy and antidepressants, it was like within a few weeks, I started to feel like myself. And that was my story of depression. And if I missed it, how many other people missed it? And the sad thing was I felt very isolated from colleagues and other people, which I really could not talk to. Next slide, please. So what happened is, next slide, you can go to the next slide. Anyway, so I wanted to just share that in 2010, after being in practice for 27 years, my husband of 30 years, he died suddenly and unexpectedly at the age of 55 years. And really, you know, it was, I knew one of the first things that came to mind was that, oh boy, I'm going to go through this depression again, which I truly did. But this time I understood what was going on and what was happening, and really sought help once again. And I tell you this story because I've been able, through the grace of God, to really understand my commitment to Hawaii and how important it is for me to, so many people help me during these dark periods, people helping me, mentoring me, guiding me, encouraging me to continue, that it's been 10 years now with my new practice, we Pediatrics Incorporated. And so I think it's so important for us to really be vulnerable and be open and not be ashamed of talking about medicine and what it can do to you, but there is hope and encouragement. And I'm hoping to reach out, even if it's one or two persons out there, just know that as hopeless as it can seem, you are not alone and there is help. So I did want to just share some really simple things that I've learned. I truly understand now about, number one, we have to set our boundaries. We have to say no when we can't do it. I also now understand the importance of not only physical well-being, but mental well-being. Number three, I try to, even though my colleagues look like they have it all together, I try to look for small changes in behavior, and I try to bring in the conversation, hey, everything okay? I think we just need to be really compassionate to one another, and we really, as in tip number 4, not make assumptions that everyone has it together except you. And this is where I find it's very important. During COVID, I lost that physical communication with my peers. So I'm hoping that in our physician organization or just one-to-one, if we can start to get back and have these conversations again with one another, asking how each one of us are doing. And finally, I think it's important to, if someone is going through a rough spot, to really speak kindly, because it can happen to any one of us, and really tell them that we are here encouraging you to get help, proud of you for getting help. We need you in the healthcare field, so continue to move forward. Next slide. So anyway, just wanted to put some resources down here, and really that's my talk for today. Is I think medicine has been such a wonderful career for me. One of the joys that I have found is giving back to the community, and my 501c3 nonprofit, Walk with a Doc. We now have 7 groups here on the state of Hawaii. I find so much reward helping people of all ages get healthier one step at a time. And I think find your passion, find your little niche that will make you happy. And I think this will go a long way. I'm hoping, God willing, God will give me, 10 more years to continue this work. But I just want people to know out there, all you healthcare workers, that there is light, there is help available, and I don't want you to give up, and reach out to friends. Thank you.
So we want to build on that. Don't worry, we're not done yet. Okay. But I need you guys' help, because you just heard some good ideas to stay well, to stay resilient. Tell other people about it, so they know it's, we don't want to say normal, but It happens and it's okay. It's something that it isn't a sin for a healthcare provider to be depressed. I remember when I was at the residency program, I told all the interns, I said, yeah, you will get depressed this year, but you'll get through it. And one of them, who's the vice dean of a med school somewhere, he was so mad at me. When he got depressed, he's like, thank you, thanks a lot. Thanks a lot. You know, that I didn't appreciate that. I'm like, hey, you know, so anyway, it's okay. You know, we do go through really difficult things. So what do we have in Hawaii to help us? Well, not much. I had a pre-med help me search, and there's not much. There are some programs, for example, Kaiser has a program for their providers, and Queens has a program for their providers, and they were then Schwartz rounds, which were a time where you can talk in a safe environment about your stresses. Then I can't even read that from here, but let's see here. I didn't know about these. Pu'ulu Lapa'au is a program for health professionals, and the mission is to promote patient safety and care by improving the health and well-being and effectiveness of those caring for them. And so I looked it up, and this looks very legit, and it is a number of activities, and there are different opportunities. So please check this out and see what you think. I haven't met with them. I'd like to meet with them and talk to them, because is there a price for it? You know, maybe no, somebody's telling me no. So this is very exciting. This is actually a place where we might be able to get some significant help. And if there are enough people who are interested and involved, maybe it can grow and we can let more people know. Let's see, I mentioned those. And then I was looking things up, and there's the Physician Assistance Program. Now, this is a group of mental health providers that specifically assist physicians. I hadn't heard of this one either. This looks like it's more targeted towards providers, but mental health experts with experience in this area. So that is an opportunity. I think they take insurance and they process it like a regular visit, but it's very private, and it's very, you know, you don't have to tell anybody at work. You know, there are a lot of employment assistance programs, but sometimes people feel they don't want to go to those, because then people know, your boss knows you're going to something, right? I have a father who's a lawyer, and he goes, oh, if you go to a counselor before med school, he said, if you go to a counselor, you'll never get into med school. And I'm like, what? And then he said, if you go to a psychiatrist, you'll never get your medical license. So there are a lot, and he said this a year ago too. Yeah, I just went to med school recently. No, but he said it again. He's like, if you go to a psychologist, he said some repercussion, and I don't really listen now because, you know, obviously I got through med school and I got licensed. Anyway, there are a couple national resources that these are more like hubs of different resources. So lists of what you can do, lists of people to contact, and SAMHSA. So the National Organization on Substance Abuse has a very good website. And so the two on the right are the national resources. But let's just talk about a few things we can do. And Theresa hit on a couple. And what I heard from it was have a group or a person you can talk to. And so you can advance the slide. Oh, yes. Okay. But anyway, I'm going to go through these out of order. And then I want to hear from the group other ideas. Because we had yoga this morning, although it was cut short, unfortunately. But you can exercise. So exercise is in here. And we know exercise helps. We know it releases endorphins. We know it makes us feel better. It's not going to take away depression. Well, actually it might, but, and actually I just heard that sleep apnea causes depression. So if that is a possibility, get checked for sleep apnea because, you know, I understand you'll feel better with the CPAP, maybe. Anyway, so sleep. I think the ideal amount of sleep is 7 to 8 hours. If you get a bunch more, okay, so the article I read was about dementia. If you get a bunch more sleep, you're at higher risk for dementia. If you get less sleep, you're at higher risk for dementia. The sweet spot, of course, is individual for everybody, but 7 to 8 hours is around that. So please try. I know you got to do your charts, you got to, you know, feed the kids, but try to get sleep. And they never tell you if catch-up sleep works. So weekends, more sleep? I think it does. I like to think it does. And naps. I love naps, but anyway. But as Theresa was saying, talking to peers and friends. So having a group of people you trust, you can talk to, they know how you feel. I feel lucky. I have a husband and we go for a walk. Actually, now I don't feel quite as lucky because he complains more than I do. So I'm like, yeah. Okay. And how was work today, dear? He's not in here. He's in another room. I can talk about him. Okay. And I just know it's going to like hit me like, you know, oh, the system I'm in is so frustrating and blah, blah. And this happened today. And then these people were fighting. And then this person was yelling at me. And then, you know, I'm like, wow. Okay. Oh, that's terrible. Oh, that's terrible. And then I start getting mad and I have to like calm myself down, you know, okay. He just wants me to listen. And then I try and problem solve and he's like, I've tried that. So anyway, at least, you know, I feel like I'm helping him. And then when I have a frustration, I have some place to share it. And so having that has been really helpful. There's something in family medicine training called Ballant Group. And it's where you can share your feelings about patient experiences in a safe, closed environment. And we tried to do one online during COVID, but we didn't have very much interest. But it's really nice to be able to say, even to a counselor, to say, these are my frustrations, and just kind of offload it. And so, you know, think about that. And then in here is taking care of your mental health. So that might be going to counseling. That might be yoga, Tai Chi, daily affirmations. There's so many things you can do to help. This exercise might be what you need. Exercise with a friend and talk about your frustrations. You know, you can combine them. Why not? So hobbies. Hobbies are great to have. I tell all the med students, you need to keep your hobbies through medical school and residency because you're going to need them later on. I don't think they listen to me, but for me, so so all this is from a Medscape survey of doctors. So this is what doctors actually said. And I know, I figure it applies to everybody really. They say hobbies here like gardening, cooking, and reading. And I have to say, I have given myself permission to spend one day a week, one of the weekend days, just reading novels. I know it sounds ridiculous. It sounds like a waste of time. And I used to feel guilty, but I feel like it kind of clears my mind. It just wipes away all the extra stuff that I'm thinking about. And I still feel a little guilty, but I do it religiously. And I feel a little better. I don't know if it's that, but any hobby you have, or develop a new one. They say knitting, crocheting, even if it's sports. So my husband's got his football team and he just loves to follow them and he talks to patients about it. And that's his thing. Oh, now I'm really good. He plays Pokemon Go. Bless him. But he got the kids going and then the kids are like, no, we're too old for this. And so he's doing his, oh my God, there's a party today. I have to go over to Safeway and I have to like, oh my gosh, okay. And we're in Europe. Oh my gosh, there's these Pokemon here that are nowhere else. I'm like, okay. That's great, honey. How's Pokemon? And then he does his fantasy football and I'm like, oh. And he's in like 4 leagues and he doesn't know who, anyway. He seems to have a lot of hobbies, but when he's frustrated with work, he says, I listen to cruise videos. so we can go on our next cruise. And so when he was really burned out during COVID, I said, okay, honey, book us a cruise. You'll feel better. And he booked 3. So anyway, and he was feeling better until he came back and was working for a while. But no, he likes to think about the cruises, hear his favorite podcasts. So whatever it is you really enjoy, let yourself do it or make yourself do it, because you need to just clear out all the frustration and relax. Let's see, time with loved ones. They say 1 hug a day. Everybody needs 1 hug a day, at least. Okay. Now I got a lot of hugs out here. It was good today. And, I don't even know if I should hug people anymore because of COVID, right? But no, there was no stopping the hugging today. So this is a good day, even though I was a little stressed and still I am. Are we still being heard? I hope. Anyway. And then volunteer work. So giving back. So medical missions or just working. Oh, there's the home clinic. What? Yay, they can hear us. I'm so happy. The home clinic, homeless outreach and education project at JABSOM at the medical school is a wonderful way you can volunteer in. We're trying to make it interprofessional. And so whichever profession you are in, we can probably find a place. I know Theresa, who is one of the organizers of it, is in the next room, so she can't hear me because she'll probably get mad if I have too many people volunteer, but it's a wonderful experience. It is definitely giving back, and it's people who really appreciate appreciation. They are very appreciative of your time and attention and your respect. And it's a wonderful way to, for a half day a week or a half day a month, actually feel like you are doing something that makes a big difference, because they have no healthcare otherwise. And they are really nice to work with and very appreciative. Let's see, eat healthy and satisfying. Okay, so it said eat healthy, but I'm going to add satisfying because there must be healthy things that you like. So eat those a little more and then reward yourself with the unhealthy thing. Like, oh my gosh, that coconut cake, I wanted to go back and get the rest of it. I like that one. I always know if we have a conference here at the Hilton, at least the food will be good. Anyway, sorry, I got distracted by the coconut cake. Okay, eat healthy and satisfying. So think about the things that you like to eat and which ones are healthy, and just balance it. Don't go overboard on the dieting and stuff. Just take care of yourself, but with healthy food, and then some splurges. And then I think the one that is always brought up first, and remember why you went into it. So I always ask the pre-meds, well, why do you want to do this? What do they say? I want to help people, right? And now we are helping people. Yes, we are tired, we are burdened, we are doing our notes at night, but we really are. Don't forget what you're doing. You are helping people. So thank you. Thank you, everybody, for helping people. And then the last one here should be the first one on the list. Take your vacations. Go on a cruise. My husband was way better after those 3. We've only gone on 2 of them, but he was reinvigorated, inspired. He didn't complain as much on our walks, but I know it's time for a cruise now because he's complaining more. So anyway, don't tell him I was talking about him. Okay. But what recommendations do you guys have for us? And I have some microphones here. I have no idea if they work or not. But, oh, Jana has one, luckily.
I think this works.
What about you, Theresa? More ideas? Anybody? Hey, it's Theresa on the video.
I do think that the volunteer aspect has really given me so much. It kind of brought me back to why I first went into medicine. And I'm a pediatrician, but the people who come to walk with a doc are seniors, because I'm a senior. So I'm just enjoying the relationship, the connections, seeing people get healthier, and I could do this forever. So, I recommend everyone really try to, the more you give back, the more it comes back to you. So, that's what I want people to know, that there are things that you can do to make yourself feel better.
Now, I don't want to do this forever. I'm looking forward to retiring. I gotta say, I admire you so much because you have so much positive energy. Was it like 8 years ago, you sat up on the stage and you cried and you made everybody in the room cry. It was the happy doctor panel. Yeah, that didn't work out so well. But look at her now. Huge smile. But I will tell you, I'm not going to retire fully because one of my hobbies, my creative outlet is grant writing. I know that's crazy, but I love to do it. I love to tell a story and bring all people together and create a picture of what can happen. I'm a dreamer. And so I love to do that. So I'm going to do that even after I retire. That's my retirement plan for how I still feel. Because you've got to, if one day you just stop helping people and all your life you've wanted to help people, that's not going to be very satisfying. Even if I'm on a cruise, you can't cruise forever. All right, let's see. You got any questions? No, any questions? Yes.
And really quick, just to follow up, Dr. Wee, you had a lot of great comments that came in online, just really acknowledging and appreciating you sharing your story. So thank you for that. There was an echo that came through for that. We did have another comment that talked about during COVID, one of the organizations did a provider support group. So that way they could have that type of an outlet.
Ooh,
Yeah, so I'm going to transition it over.
Yeah, Dr. Kelley, thank you for your overall that I use a lot of that for my patient, but one thing I want to add on to it, this is something that I teach medical students and my patient for stress reduction. If anybody in this room would have a piece of paper and the pen, please write this website down. I don't have time to get into detail. It's the www.thetappingsolution.com. Tapping is that you tapping your acupuncture point. Thetappingsolution.com. This will teach you how to do self-stress reduction, and I give this website to all the medical students and all of my patients for the stress. Basically, this stress is an overacting sympathetic system, which is adrenaline driven, that cause a lot of stress. And then when you are doing those acupressure points, you are encouraging the parasympathetic system to counteract sympathetic system, which is very, very effective and quick. So when you are doing the tapping, the website will guide you how to say specific affirmation, like Kelley was saying, there's an affirmation. Each person has different, but they will teach you how to do that. Even though I'm so angry at so and so, I choose to release this, and then I choose to replace with love, peace, and harmony, and so on and so forth. You are telling your parasympathetic system to activate that to counter your stress, your adrenaline, which is coming get balanced. So this is just a very quick science background for you, because this is not my lecture. But just go to the website, you will see treasure, help yourself. And Kelley, remember we went to Beijing University 2014. We want to continue to bring that knowledge from the East, bring it to the Western medicine, and we are still working on it. COVID stopped us. So we were going to revive that program again. We used to call it Complementary Alternative Medicine Department, but now it's been changed to the name called Integrative Global Medicine. So we just start working on it just recently. Thank you.
Thank you. Oh, and there's a question in the back. And in the meantime, Dr. Jennifer Lowe says, be compassionate to yourself. If dinner is late one night, that's okay. If you leave late one day, it's fine. If your house is messy, life is still good. I think we healthcare professionals are too hard on ourselves. Don't demand so much of ourselves. And I have to agree with that because my house is messy and I feel guilty sometimes because my kids are grown, but I didn't get them a nice enough playhouse, or, I didn't do this or that or that. And they're like, Mom, I don't even remember that. At least they know I love them. And yes, they know I work a lot and they're like, oh, Mom's writing a grant, leave her alone. And they joke about it, but they know I love them, and that's really the most important thing, and that I'll be there for them, whenever. And if Mel didn't get to see her son, what was it? Grand Slam. She loves him, and she told him she did. So bless them. Sorry, go ahead.
No, that's okay. Thank you. I am not a physician, so this comes as things that I've noticed. I've worked in teaching hospitals across this country and have seen residents come up through the system. So this is more of a systemic point of intervention. And so this might be controversial. Physicians' residencies seem a lot like bullying to the outside. And this morning in one of the sessions, and it was talking about physician resiliency, and there was still sort of a pervasive attitude about, somebody who couldn't hack it essentially past day one of their residency. And that has nothing to do with that person's individual level of resilience, but that's the perception, correct? And so if you look at that process that probably a lot of you went through as an outsider witnessing it, it's hard to witness. So that's somewhere that I sort of think that maybe as a profession, there might be a point of intervention to look at how do you actually more effectively support the mental health of residents who have just gone through however many years of medical school that you've gone through to do the thing that you think that you're going to be most passionate about without burning out on day one of your residency so you can be more effective.
You are exactly correct. And it is seen as bullying from the inside as well. And it is changing. They now survey medical students and residents every year about have they been exposed to violence, have they been different forms of harassment. So there is awareness for that. And I believe with time, these things will change. The standard way of doing things is no longer acceptable. And so it is changing. It's not changing fast enough. We had 20 years ago, we had the work hour restrictions. So it used to be that you could work 100, 200 hours a week. 200 hours a week. And then they limited it to 80 hours a week. But if you were a surgeon and you wanted to stay in the hospital and watch your patients, they couldn't tell you you could. They couldn't tell you you couldn't, but they could say, well, you should. And so they kind of got around it anyway. So and medical students have no work hour restrictions that I know of unless something's changed. So it is a brutal career, and we really should be, as Pono Shim said, kid gloves. We should be gentle. We should help each other through this. And, the senior doctors should be gentle with the whole team. The surgeons used to throw things across the room at people. That's not allowed. People get kicked off staff if you do that kind of thing. So at least, they're little steps, but it is getting better and better. But it's brutal because you're exhausted, you're hungry, you're standing all the time, your back hurts, or you're sitting at the computer, your eyes hurt. And, anyway, yes, you're completely right. Anybody?
It has gotten better. I mean, I grew up in an era where, I guess I'm dating myself, where the problem with every other night call was you missed seeing half the interesting patients. But we've gotten better than that. I was really going to talk about something else. And the something else is that we are, as a species, designed to focus on the bad. And it makes sense, right? If you miss seeing the saber-toothed tiger, you got eaten. So your genes got taken out of the gene pool. Whereas if you miss the apple tree, yeah, you might find the apple tree the next time and then, and pick the nice fruit. So, I mean, the byproduct of that, I mean, I heard somebody else say, the secret to a happy marriage, it's like 5 fornications for every fight. They said something else other than fornication, but I thought we ought to leave it kind of PC for this audience. And I'm a pediatrician, so, but really there's other ways of kind of thinking about that. And one of the things is the 3 good things. I don't know how many people have heard of 3 good things? Oh, good. It's an app. You can do it as an app, and I think it's the 3goodthings.org. I don't remember exactly, but if you Google 3 good things, you'll find it. But you can do it yourself. It's just that usually at the end of the day, shortly before bed, write down 3 good things that happened to you today. And it helps you to focus back on the good stuff that happened. And it could be something simple like, oh, I saw a rainbow, or, my patient got better, or whatever, you want to, but I think focusing on those things will help us realize there's a lot of good stuff that still happens to us. And we forget about it though, because we always focus on the bad stuff. Oh, this patient got sicker, or they refused to take their medicine, or whatever else, we kind of, that sticks in our brains, and we kind of unstick that stuff and get ourselves to focus on the good things.
Positive affirmations, absolutely. And I always forget. That was one of my New Year's resolutions last year. Say 3 things I'm appreciative of every night. I'm going to start doing it again. Thank you. Thank you. It's free, it's cheap, it's easy.
I have one more to add on to the comment about physician, how we were trained. I totally agree with you. I went through that 30 years ago, and we called it the Days of Giant. Have you heard of that, the Days of Giants? Our attending just said we are such a hot shot. But anyway, we went through it. I think what reason I went through it because I was an Asian woman. I do my best capacity is bow down and say yes. So because of that culture that I grew up, I was able to survive through that bully. But when I came out, I really was hurt, and I realized that. And I'm very glad I stumbled through this physician acupuncture group, and I went to there. It was just the whole room filled with American physicians. I was very touched. And when you start learning, your anger affects your liver energy, worry affects your spleen, fear affects your kidney, and hatred affects your heart, and so forth. These are coming from energy medicine. I start realize I had to be careful about that, but that was not taught in Western medicine. And I was so glad to grab that. My biggest savior is the Western doctor who taught me Chinese medicine. Can you imagine that? I have to learn Chinese medicine in English to believe in that, because he told me acupuncture improve endorphin. That was very nice. I love endorphin. I don't want to hear the cheap stuff. So Dr. Joe Helms is the one that he go to his website. I will be happy to share with you. I don't want to become a lecturer to you guys, but learn the energy medicine will help you, and they help your patient. You will never have to be the Days of Giants. You can be compassionate with yourself, compassionate with patient, and you see patient become better without drug. That is your antidepressant. You never have to go home to feel depressed, because your patient are so grateful, so thankful that you can give them allergy-free without drugs. I can do that. I can make somebody that gluten-free without drugs. It's not magic. You take the class, you can learn it. Thank you.
That might be a good note to end on. You want to add anything, Theresa?
No.
Well, let me tell you guys a few secrets. In your badge, there's 2 tickets. They're for the bar out there. I forgot to tell, Josh didn't even remember that one. So there's 2 free drinks for the bar. And all the PowerPoints and the videos are going to be on the website, and we will move them over to the AHEC website. So if you missed a session, you can see it. And I'm going to show you where the PowerPoint is from lunchtime because it is up on the website. If you're going back to the airport, I think the bus leaves at 5:30. And the raffle, they drew the rest of the names and they're all up on that board over there. But if somebody doesn't pick them up, we're going to have to draw names again. So check back at the board at the far end. Any last questions, comments? Please fill out your green evaluation form. Tell us what you want next year. I'm thinking an energy healing session would be good. I'm thinking of having Nadine do her thing again and seeing what progress we've made. Don't forget to vote for the solutions on the back of your map. And thank you guys for coming. Next year, we're going to do better with the online bit. Sorry to all you guys. It was kind of painful, but next year will be better. But come in person anyway. Okay, thank you guys very much. Bars out there, raffles over there. Yay!